Guys, this next video I'm going to show you how to do some knee mobilization. Okay, so we're going to use this knee mobilization technique if you've got that, if you've done that overhead squat assessment and you've got that knee bow in posture going on. So that's where we do our squat and we notice that this happens. We're going to squat down and the knees start to kind of collapse in together. Okay, so we're going to squat. You know, it's going to come in this way, maybe not so much as this, but it can happen, even if it's just slight. So again, that knee is no longer in line with that second and third toe. It's more like in line with the big toe or even inside of the big toe. So if we see kind of any of this going on, again, definitely if you've got any kind of knee issues happening right now, it might be some arthritis in there as well. So any kind of knee issues, this could definitely help. Definitely if we've got that knee bowing push and you've got some knee trouble, what this is going to do is help open up some space within the knee joint and just help to get better alignment of those two bones, that patella, sorry, that the femur and the tibia, helps get that alignment. Because essentially what's happened when we do that overhead squat and we see that those knees collapse in, technically what's happening is this femur is rotating inwards this way and the tibia is rotated relatively externally out that way. So they're both kind of going in opposite directions. Femur's going inwards, rotating inwards, tibia is rotating outwards. So this can just help to get those proper kinematics between those two joint surfaces closer to optimal how they should be, how they should move. So what we're going to do is we're going to get one of these big thick bands, and you're going to put your leg in there. And what we're going to do is put this band just at the back of the calf, right near the top, just below that knee joint line. Okay, so just below the line of the knee joint. And what I'm going to do is I'm going to just stand back and get plenty of tension on that band so it's nice and strong. And I'm actually going to take a little step to the side. Okay, what that's going to do is, now that it's kind of orientated diagonally, so what that's going to do, as I put tension, as I go to do this technique and I put tension through this band, that force is going to help, that force generated by the band is going to help to rotate my tibia inward. Okay, so it's going to help with that proper alignment between the femur and the tibia, so we get that proper knee joint alignment, get those better kinematics going on. So I'm going to step back, get plenty of tension, come to the side. I've got my foam roller just to give me a bit of stability, and all I'm going to do is I'm just going to be doing the last few degrees of knee extension. So knee extension is that where I lock out my knee. Okay, so I'm just going to let it relax, push back, let it relax, push back, let it relax, push back. So that's the movement. It's just very small motion, but because it's a mobilization, we want to do one or two oscillations. So that's an oscillation, just the movement, one or two per second. Okay, so I'm going to get it all set up. Okay, just going to let my knee flex a little bit and I'm going to extend it and just keep rocking back and forth just like that. Okay, so again, band's just at the top of the back of my knee, one or two per second. I keep this foot that I'm mobile on the side of the leg that I'm mobilized and straight, so second and third toes forward. Okay, and turn it in a little bit if I need to, get more of that rotation going on. And then we have it. So we're just about 30 seconds to a minute, one or two oscillations per second, just like that. If you do feel any discomfort, okay, so say this is fine, and then just run into a little bit of pain and discomfort, that's okay. Just go to that first, just go just up to that point of discomfort. So if you go to here and it's okay, that's fine. Use the range of motion, use the pain-free range of motion that you have. Don't force pain, don't go right into it. We don't want to set off that inflammatory process. So just go up, just go, oh, this is okay, yeah, that's all right. I've got a bit of motion there, so use the motion that you do have. That's absolutely fine. Again, if there's no discomfort, no problems, again, get that full extension back. Again, just 30 seconds to 2 minutes. Okay. So that's our knee mobilization. Again, especially if any of us are struggling to get our knees to lock out, maybe due to arthritis or whatnot. Again, maybe this can just give us that little bit of range of motion back. And again, if you've got any knee issues, okay, especially where like I said, that the tibia and the femur are not aligning. That's normally a big problem that happens. Is normally a big cause of knee pain. And again, you can highlight that when we do the overhead squat. So if you notice that you've got some knee issues and you've got that knees bowing in, maybe this is a good technique to try again with all the other techniques that we're doing. That kind of really goes a long way, or definitely helps at least to, getting rid of those symptoms, those painful symptoms, and it really helps to correct that knee alignment. So that's our knee joint mobilization. So band's just going to go back of the, just at the top of the back of the calf. Okay, we're just doing those last few degrees of knee extension, 30 seconds to 2 minutes, just one to two oscillations per second.